name's Dr. Manrina Rhode. I am the aesthetic dentistry expert for dentistry.co.uk, and today I want to talk to you about developing trust with your patients. I think the most important thing when you first meet a patient is to make them feel heard and make them realize that they are your priority, which they are and which they should be. So when they come into the room, make sure you're looking them in the eye, you're giving them your full attention, you're listening to what they have to say, and once they've told you what their concerns are, that you're repeating them back to them and showing them that you care and that you're listening. We really pander to every one of our patients' needs. I'm very careful to listen out and to remember things that they like and that they don't like, so we make sure that we optimize each appointment and make them feel like they're part of the team, part of the family, and that we really care, that they're comfortable. Trust is an interesting one. I would say daily, someone will leave my room and on the way out they'll be like, "Oh, I trust you, Manrina," and I feel like it's something that they feel the trust and they feel like they need to vocalize it, and I find that really interesting. And equally, if I felt that a patient didn't trust me, I don't think that I could continue with their treatment plan. If I felt like they were questioning my choices, or the way that they were interacting with me was not one of trust, mutual trust between the two of us, then I think it's very difficult to continue in this sort of professional environment. A dentist-patient relationship, trust is super, super important. Trust can be earned. It can be earned over a period of time. I heard Corey Ferran talking recently, and I thought it was really interesting. He said, and I'm paraphrasing him if you're watching, Corey, he said that you can build trust with a patient by telling them, there's this issue in your mouth, we're going to keep an eye on it, and at some point we'll need to do something about it. And then maybe when you see them for their checkup a year later, then you mention it again and say, this issue's still there. And by then they've kind of built the trust, they've had time to think about it, and then it's kind of like a long game that's like, okay, now it's time and let's do something about it, and then you retreat them. And so that way trust is built, but equally you can build trust by building your own reputation. So if you spend time as a dentist writing articles, doing podcasts, recording videos to educate other dentists such as these, this is for other dentists, but recording videos that are available to the public, then before a patient even comes to see you, they've already chosen you, they trust you, they know your name, they see you as the expert, and then that really reduces the time needed in having to build someone's trust, because you've already built it by the way that you've built your own reputation within your community. So I think that's an interesting thing for dentists to think about. There's many things that we do within dentistry. There's many things that I do for free within dentistry to provide value within our profession. As I do it because I care about profession, and I care about I want people to do the best treatments and to understand the best way to treat our patients, and to also improve the reputation of our profession. But equally, I do it because it also allows my patients to get to know me, to get to know the knowledge that I have, to get to know the reputation that I have, to understand how I speak, how I look, how I am, how I feel to them, so that they can choose me, they can find me, they can choose me, they can come in, and then that gets rid of that one element of my business, the sort of having to find patients or marketing aspect, because they come by themselves to you and they trust you. So yeah, maybe that's a takeaway to have a think about today.